I'm Dr. Neil Mandalaywala. I'm double certified in pain management and physical medicine and rehabilitation.
What is neuromodulation therapy, and when is it typically recommended for patients with chronic pain?
Neuromodulation is the use of heat, chemicals, or electricity to alter the pain pathway. When thinking about chronic pain, this is a treatment that can be offered at all stages across the pain management journey, both near the beginning steps, but also near the end, regardless of where the patient lies in their individual journey. The nicest thing about neuromodulation is that these treatments are often tailored to the patient and are tied to individual goals. Lastly, they often are reversible, meaning that they don't have to be permanent treatment solutions.
Can you walk us through the different types of neuromodulation therapies you use in your practice?
Neuromodulation comes in various forms. The most common one I'm typically asked about is spinal cord stimulation. This is a specific type of treatment in which I use electricity powered by electrodes to alter the pathways in the spinal cord that communicate pain signals. Other options include things such as peripheral nerve stimulation that work outside the spinal cord, radiofrequency joint ablations, as well as the use of intrathecal or targeted drug delivery in the form of pumps. Ultimately, these are just one of the various tool sets that I have to help me manage chronic pain.
What are the benefits of neuromodulation therapies compared to surgery or long-term medication use?
Neuromodulation has a lot of key benefits that I think supersede that of long-term medications or even surgery. Long-term medications unfortunately carry long-term side effects and complications. We see this clearly in the data, and we also see this in our own patients and their lives, with the medications losing effectiveness over time and coming with side effects as we continue along our journey of life and our pain journey. Surgeries themselves can also be very tough for patients and their families, both in terms of the surgery itself and recovery. Neuromodulation techniques are minimally invasive treatments that really carry a lot of benefit, and the key thing about them is that they're often reversible, meaning that they can be put in and tried and see if patients can improve without necessarily committing the patient to the treatment long term.
What does the patient experience look like from consultation through recovery for a treatment like spinal cord stimulation or a pain pump?
When a patient comes to me and is exploring these treatments, the first and foremost thing that I do is I'll get a very thorough, detailed history and intake. This includes understanding more about the pain, also understanding who the patient is that experiences this pain, understanding their goals, understanding their wishes, and understanding their prior treatment history. With a focus on spinal cord stimulation as an example, if neuromodulation with SCS is a good treatment option, I'll then perform relevant further workup, including obtaining the best imaging, as well as doing a very thorough psychological screen. This will help me ensure we achieve optimal outcomes. From then on, we will do a trial run in which we put temporary electrodes stimulating the spine in the back at the procedure center. During this time, I will ask the patient to trial these technologies, including trialing them for their normal life, as well as activities that bring them joy and important activities such as their job or occupation. I'll bring them back into the office where we'll both mutually appraise the treatment and see how it went, looking at key metrics like pain score, sleep, activity tolerance, and quality of life. If we mutually agree to move forward, we'll set up a date where we put the device in permanently. This is a procedure in which we put the permanent electrodes in along with the battery that powers them. This is a minimally invasive surgical procedure that has an excellent recovery time and allows patients to get back into their quality of life and goals faster and quicker.
How do you determine which neuromodulation therapy is the best fit for a specific patient?
When I think about treatment, I always think about the cornerstones of my practice, and that includes no one size fits all, and that treatment should be tailored and individualized. I think about my parents, who are both physicians, and what they taught me, that treatment should be geared towards the patient, should be achievable and doable by the patient, and provide meaningful results and the least amount of long-term harm. When I consider all the treatments at my disposal, I think about these things when I partner with the patient and I educate them. If neuromodulation treatments such as spinal cord stimulation are indicated, I'll make sure that I partner with the patient every step of the way to help them ensure they achieve long-term sustainable success.